Welcome back, everyone, to the Burnout Club. This is a place where we explore burnout and success one expert and experiment at a time. I'm your host, Patrice Bonfilio, and today I'm joined by Dr. April Joy Damian. She's the Chief Scientific Officer and Director of the Weitzman Institute and Moses Weitzman Health System. So, April Joy, welcome to the Burnout Club.
Thanks, Patrice. Excited to be here.
Yes. I love talking to people that are making a huge impact and also are in charge of incredible health systems and missions the way you are. Can you talk to us and just let the listeners know a little bit more about you and what you're doing?
Yeah, thanks, Patrice, again for having me. So I currently oversee the Weitzman Institute as its director and serve as a chief scientific officer in Moses Weitzman Health System. So at the Weitzman Institute, we really focus on innovation in safety net primary care spaces, historically in community health centers, and we do that through research, education, and policy. So on an annual basis, we reach about 2 million patients through 40,000 healthcare professionals in about 1,200 health centers across all 50 U.S. states, D.C., Puerto Rico, and Guam.
That's comprehensive. So just think of the sheer scale. One of the reasons why I wanted to talk to you was because there's such wide reach. So, was that part of what drew you to be a part of that health system? And if not, what were the main drivers of wanting to work in this type of institute and health system?
It's a great question, Patrice. So I was recruited back in 2019, and I think the first draw was the focus on underserved populations and marginalized populations, right? We
Mhm.
all know that we have a fragmented healthcare system and that it's not working for most people. And then
Mhm.
oftentimes, your different identities, including your socioeconomic status, may determine what you have access to or don't have access to. And the idea of the tagline of our parent organization, um, healthcare as a right, not a privilege, really resonated with me, right?
Mhm.
Someone who I knew since childhood, I wanted to be in the healthcare space. Originally, I thought I was going to be a physician, went that route, and then realized I was more interested in the macro approach and in research.
Yeah.
And I think that opportunity to think through not just the basics, but also innovation, right? How do we
Mhm.
make sure that not just the communities I've just been talking about, but also the workforce that serves them in the front lines and the health systems have the best access to the latest evidence base, the training
Mhm.
tools, infrastructure, right? That it's not this two-tier healthcare system, but really making sure it's accessible to all because everyone's health affects our own health, whether or not we choose to accept that truth or not. And so the idea of that we're constantly innovating and constantly thinking through new ways of challenging chronic issues, right, has really been exciting. I think what's kept me here, which I think is sometimes the better question, and I constantly ask my staff to reflect on this, is the people, right?
Mhm.
Be around other people who are also mission aligned, who want to make an impact and drive positive change, who come from different walks of life and even trained in different disciplines from my own. All want to come together for this shared North Star of healthcare as a right, not a privilege. And so I think it's just really exciting to be in this space, especially at such a critical time when it's most needed.
When someone talks about innovation, and it doesn't matter if they're a technology person, if they're in healthcare, if they're just, an everyday person that has a 9 to 5 job. If the focus is on innovation, then there's just a level of inherent optimism. Like we can actually make things better, we can change. And I think that helps a lot with burnout. Were you always someone that thought about innovation and improvement, or was that something that found you later on in life?
I think so. I always attribute it. So I grew up in San Francisco, Patrice, and
Mm.
my parents were very much mission oriented, right? It was always, I think with innovation comes being able to think critically. And I
Mm.
remember I often share the story, not just of growing up in San Francisco and being exposed to different social challenges from homelessness and poverty to unemployment, but also when I finally went to the home country of my family, which is the Philippines, I remember witnessing a form of human trafficking, but also just like child prostitution. I'm like, I can't believe this is happening. My father was saying, and you're going to be in a position to do something about it, right? And I think the
Yeah.
idea of thinking critically and innovation is an issue exists. Instead of complaining about it, what can you do, one, to address it, and then how can you do it better, right? So this
Hmm.
continuously thinking through how do we do things better has been a lifelong journey of mine in different areas of my life, both professionally and personally.
Oh, absolutely. And how do you tackle that? Just trying to pick apart your brain, right? I think some people have an easier time taking a humongous problem or something that is just very pervasive in a society and saying, okay, we can actually change it. So how does your mind work when you see a problem and you want to start tackling it?
Yeah, so Patrice, I'm trained as a researcher, right? So
Mm,
it's like first thing is like, what have others done, right?
yeah.
How do I not reinvent the wheel, and how
Hmm.
do I learn from others' mistakes or walls that others have hit, even if maybe they've tried something and maybe I can find and build on their success and
Yeah.
something, right? Because I never
Hmm.
I always think any idea I come up with, probably someone else has come up with it before. It just wasn't the right time, right? And so
Yeah.
the humility that comes from being able to look at the existing evidence base and saying, like, what's been
Hmm.
tried? Why didn't it work? Before I start going at it, right? So I think that's the
Hmm.
first piece. And then evidence looks different, right? Some of it is based on what's published, what's online. Some of it is through conversations with people who've been in the field. So just the information gathering, I think, is the first step because without that, I think it's just probably going to be spinning my wheels and using my time not as efficiently as I could be. So
Hmm.
that's the first
Yeah.
approach. I think the second is also, which can be hard to come by at a time when we're so inundated and probably overstimulated, is getting quiet, right?
Mm.
I think some of my best ideas, I'm giving this all away, Patrice, getting still, right? Because it's like the phone
Hmm.
can be going off, Outlook could be alerting me of the next meeting, right?
Yeah.
Be walking in, a neighbor could be remodeling their house, right? And I
Yeah.
think just to be undistracted and to
Hmm.
unplug and just have
Yeah.
my notebook of like drawing out. So I'm very visual and just getting a whiteboard,
Mm.
my notebook, thinking through ideas based on what I've already looked into and feel. Um, and then revisiting the evidence, right? I think sometimes
Okay.
you look at it once and then you can see it based on maybe the mood, the weather, right? But then after
Hmm.
self-reflecting can come back to the same data um, and see it differently or through a different lens.
That's so true. I just want to pop back to the second point you made, and I wonder if there's something subconsciously happening with me in that I I've been leaving my phone at the house just by accident, and my phone just died for half the day 'cause I'm traveling. So I wonder if my body's just like, you need silence. No distractions. It's just happening on its own. So maybe I should start doing that a little bit more intentionally now. So you'll be the impetus for that. I love what you said about research, and I think it is helpful for those that have not studied research to know how to tackle a problem and then be able to act on it. Is there anything specific on the research side that you find incredibly interesting at the moment, either that you're working on at the Weitzman Institute or on your personal side?
In terms of topics or approaches or just
Whatever's most interesting to you, right? Your domain, I'm tapping into it. What kind of sparks that sense of excitement for
yeah.
you right now?
I mean, right now, I mean, again, being trained as a psychiatric epidemiologist, right? So my focus has largely been in the mental health space.
Hmm.
My scholarship has largely focused in childhood trauma and strength-based approaches to promoting youth mental health. I
Hmm.
think we're at a really interesting inflection point in terms of how we're understanding and looking at mental health and talking about mental health. And that's not just in childhood. I think it's across the lifespan, right? From
Yeah.
older adults to, pregnant mothers and their mental health
Mm.
and everyone else in between, right? And I think
Mhm.
being able to think through new ways of addressing old problems and maybe
Mhm.
problems, i.e., mental health, that we weren't talking
Mhm.
about in the past for different reasons, right? There wasn't enough research, stigma, reimbursement, right? And I think just excitement around mental health. We're even seeing it in the private sector, right? In terms of the emergence of technology and apps,
Mm.
wearables to track one's mental well-being, right? To help understand one's mood and sleep patterns. So I think it's just a really exciting time in that we're seeing mental health, and I say mental health and not mental health care, which
Mm.
well, I'm in healthcare, right? But then mental
Yeah.
health being normalized in mainstream outside of the healthcare system, right? Outside the four walls of clinical
Mhm.
practice. So I think that's really exciting. And that we're seeing different disciplines, not just folks like myself who are classically trained in these
Yeah.
fields, but also innovators, right? Patrice, we were talking about innovation. And I think
Exactly.
the role of entrepreneurship, right? And the engineers and the other folks who may not have been involved in mental health. And I love being able to tap into people's strengths and seeing how do we
Mm.
combine all of those to address this wicked problem. And so I think
Mhm.
it's a really interesting time. I think the current generations are the ones who are also allowing for us to normalize these conversations. And
Mhm.
so seeing more youth and family voices talk about mental health and advocating for mental health has really been exciting.
Yes. And, do you think that there's a broadening of acceptance to talk about mental health? Do you think there's also more acceptance and less stigma talking about mental illness? And I just bring it up because my brother has schizophrenia, so I've been talking about it in pretty wide circles for decades now with varied reception. And I applaud how much we're having conversations about mental health. I just don't know if it's always translating to acceptance, broadly speaking. What's your stance on that?
Yeah, such an interesting point, Patrice, and thank you for being part of the aiming to normalize conversation by sharing about your brother. And yeah, I think the mental health, sometimes it's easier to talk about the great things and not the difficult challenge, difficult things. And I think
Yeah.
we still, and this is my own opinion, not necessarily my organizations or the different affiliations
Sure.
I have, right? I just recognizing we still have a ways to go in terms of talking about people with mental illness, right? Of
Hmm.
how they're portrayed or misportrayed by society, by the media, in the workplace, right?
Hmm.
I don't think even in the workplace in general, we're equipped to know how to support staff who may be struggling through a mental illness, right? And I'm not just
Hmm.
talking about like, with the pandemic and we're all experiencing the pandemic, right? And the stress
Yeah.
from the psychological wounds that we're still recovering from that. And then, with unemployment, all of those things. That's not what I'm talking about. But when we're talking about serious mental illness, I think we have a ways to go. I think for
Hmm.
certain mental illnesses like depression, anxiety, I think we've come a long ways, but again, there's so
Hmm.
broad. And autism, right, in children, I think there's certain
Yeah.
mental illnesses or even, yeah, mental health challenges, right, which aren't, there's a difference, right? There's those who have
Yes.
depressive symptoms, but then versus major depressive disorder, right? I think we've come a
Hmm.
long ways in talking about certain mental illnesses, but not necessarily all. So we come a long way in some areas, but still have a ways
Hmm.
to go in others.
Yeah. How do you think burnout fits in the conversation around mental health? What are you seeing, or what do you want to see, I guess, too?
Yeah, I mean, I was listening to some of your other recordings, Patrice, of your other episodes, and I think it's such an important topic that you're covering through your podcast, right? And there's one
Thanks.
question you had there about prevention. And I think
Mhm.
just in general, in the US, we're not very good at prevention, right? We wait until, and it's not
Yeah.
just like mental health, it's not just burnout, it's
Mhm.
also like chronic disease, right? Diabetes, hypertension, high cholesterol, obesity, right? These all the other chronic health challenges that we
Yeah.
only
That's
start
fair.
paying attention once it's there, right?
Mhm.
Where as opposed to putting up the guardrails or making modifications to our lifestyle before it even becomes an issue,
Mhm.
right? So I think that's the overlap I see with the two of like, okay, we only start paying attention to burnout once we realize we're a little, more chippy during those meetings, or we're losing sleep, or productivity is in declining, right? Or we just are easily irritated by everyone, or just we're off and we can notice it, right? As opposed to
Yeah.
same thing with mental illness, right? Of like
Mhm.
just sweeping it under the rug, right?
Mhm.
Or not seeking help for various reasons, right? It could be due to access issues, affordability, or it could be the fears that around, seeking mental health services, or
Mhm.
thinking that maybe one had a poor experience or a family member had a poor experience
Yeah.
trying to seek. So, right. So acknowledging that it's not just an individual, as a society in the US context, we're not very good at prevention in general. Uh,
Yes.
and that also applies to both burnout and mental illness.
Do you think there's any steps that people can take proactively to try to prevent it?
Burnout or mental illness?
Yeah. Oh, sorry. Burnout, burnout. Yeah.
Yeah, I think in addition to listening podcasts like yours, right? But I think there's also the educating piece, right? Like raising one's
Mhm.
own self-awareness, right? Because
Mhm.
I remember even when I was working on my dissertation that was around trauma and trauma-informed care, sometimes you
Mhm.
just take it as, well, everyone in my family goes through it, right? All my
Yeah.
colleagues are going through it. Uh,
Mhm.
it's always been like this, right? And so I remember a mentor introduced me to normalizing trauma. And so to some extent, we've normalized
Mhm.
burnout, right? Or we've equated burnout with productivity, with success. It's like,
Mhm.
right? And
Yeah.
I think but once you start educating yourself and raising your own awareness about burnout, I think that's the
Mhm.
first step of like, oh, that's why I'm always so tired, or my sleep is interrupted and I can't fall asleep or stay asleep, or I don't seem to be, you know, my relationships seem to have changed for the worse,
Mhm.
professionally and personally, right? Like to start seeing
Yeah.
signs so that once it's there, because if it's one of those, my coach talks about unconsciously incompetent, right? And so if you're not even aware of what
Oh,
the signs are about burnout, then how are you going to know that you may be experiencing early signs of it, or that you may already be, you know, waist deep in burnout? Right? So I think the first step is
yeah.
always raising one's own awareness. And then I find by teaching others or sharing knowledge with others, it also helps connect those dots inside for me, and, reinforces the knowledge for myself. And so once
Mhm.
I have that knowledge, being able to share it with others of like, did you know, right? Just at least planting those seeds and starting a conversation while reinforcing that information for myself.
Oh, yeah. 100%. That's that's why I do the podcast. I'm like, if I'm not talking about it, then I'm not going to actually put the attention into to preventing it. Do you have any, let's say, go-to techniques or things that actually bring you joy that help revitalize you? It's really just a question about, how you're inserting fun and joy in your life. I think you need that in part to make sure you're preventing or mitigating burnout, especially when you have a job that's so large and important. Just trying to tap into to what you do.
It's so funny. This was a theme of I had with a prior therapist, because I was like, my first name is April Joy, and sometimes I'm just not joyful.
Yeah.
Right? What if you have, and he said, to have more joy, do more things that make you joyful. Right? I'm like,
Hmm.
oh. right? It was just like aha moment. He's like, I know, just think about it, right? And
Yeah.
for me, it was like, oh, I enjoy spending time with our dog, right? Like sometimes just
Yeah.
petting our dog, going for a walk.
Hmm.
At my place of employment at Moses Weitzman Health System, sometimes we have these different health challenges that they get us to do. And one was about awe and wonder. And remember there was one was like step
Oh.
out and like use your five senses, right? Of like
Hmm.
notice the different colors and the smells and the sights and touch. And I think just
Hmm.
being able to tune into my, different senses was one. Another is being able to spend time with people and in activities that fill my cup. It was really challenging in the pandemic. My husband and I talked about, I think we got a little socially awkward being
Hmm.
confined
Yeah.
for so long. And then they realized, oh, I forget what it's like to be around people we care about or to meet new people we have
Hmm.
shared interests with, right? Whether that's trying a new restaurant or
Hmm.
volunteering, which you can get burnout from, but that's a different topic, Patrice. Or
Yeah.
maybe we can get to that.
Yeah.
I mean, like,
Yeah.
all too much of a good thing can be too much.
Hmm.
So
Yeah.
I think those things, and then just spending time either traveling or reading, but just making sure that being intentional, like, it has to go on the calendar, you need to block time.
Yes. 100%. You hit on so many good things. And when I first started the podcast, I was shocked that so many people were mentioning nature, like go out and touch grass. It's like, okay, I have to remember to do that. And then I forget about doing it and I don't do it for months. But I like the five senses. And I tell my kids that 5, 4, 3, 2, 1 technique, right? Like the five things you can see. And just remembering to use your senses outside, I think, is a quick thing I might try. I'm going to try that this week. That's not the challenge you selected for me, but I'm going to try that one anyway. Yeah, that was a good one. But you also bring up a good point about volunteering, because I've had to really rein myself in sometimes. I want to do good and I want to be involved. And then it's like, okay, now you're on all these committees and you're overcommitting and it's too much. So finish what you were saying about volunteering. Talk a little bit more about that.
Yeah, I mean, my husband and I could talk about this for hours. But, the issues we tackle at Weitzman Institute are not, they're not small potatoes, right? These are really
Yeah.
huge challenges in the healthcare field and society, right? We talked about in great length about mental health, talking about, access to care. For me, on a day-to-day basis, I don't really interact with patients as much, right? To some
Mhm.
extent, we have patients who serve as advisors to our different research education policy projects. We do community engaged research, but for the most part, I myself am not directly in the front lines, right? I
Mhm.
work with clinical colleagues who are there day in and day out. I volunteer and I continue to push for, with our staff, engagement of folks with lived experience in our work because it puts a face to the numbers
Mm.
topics, right? And so I do it not just for my professional, but it also like reminds me of the human connection of why I'm doing what I do,
Yeah.
my profession, right? And so to a certain extent, they remind me, right? Because without the human connection, I
Mhm.
can get lost or engrossed in the articles and the emails and the
Yeah.
projects and trying to secure funding and build partnerships. And I have to
Hmm.
remember who is part of a primary motivator, right? Of like why I'm doing this. And so that's a huge motivator for
Yeah.
volunteering. What we were addressing earlier, there's so many topics though that we want to address, right? Like
I know.
homelessness, and in DC, it's like there's a huge homelessness population, right? You have
Hmm.
children who, you know, don't have access to structured recess or physical activity, and you're seeing obesity at younger and younger ages. Like, oh, I want to be part of that so that kids can get moving and can avoid
Yeah.
all the chronic health issues that come with obesity, right? Prevention again, right?
Hmm.
And I'm like, oh, I want to be involved. So I think there's just so many, there's such great need. And we're very
Yeah.
involved in our church as well, where we help folks explore like purpose and gifts that people might have to be able to be of
Mm.
service in society, right? But then it can also take up a lot of time and energy. And then sometimes it feels like, oh, wow, there's more need than I'm able to give, right? So it gets
Yeah.
very humbling at the same time. So I just
Mhm.
remember, okay, like I don't have to do everything all at once in the season and just being able to
Yeah.
pace myself. Same thing with my husband. We talk about this often. I'm like, okay, we're middle aged, so I can't do
Mhm.
all of these things. We might need a little more rest and reset in between these different activities, as important as they are.
Yeah. But I think even your terminology is important and helpful. You mentioned the size of the problems sometimes are humbling versus overwhelming. And I think that's a nice way to ground the thoughts, at least in my head. Yes, okay, it's humbling. I'm one small piece of the solution as opposed to just feeling overwhelmed overall at the problem itself. That's very helpful to me. It makes so much sense what you're saying about connecting with the people, like volunteering to have that face. It's so easy to get caught in the everyday race and the to-do lists and the tasks and the achievements, of what you're trying to work through. But I'm sure it reduces the likelihood of burnout that you're remembering the why.
Mm,
Right? If the why gets lost, I'm sure you're closer and closer to burnout.
yes.
The universal you. I'm going to remember to do. So, question for the audience, right? Do you actually know your why? And do you like your why? Do, is it still the same why that you started with? Well, that's some exploration there. Now, I wanted to ask you, because a large portion of our audience is in the healthcare field, totally different aspects of it, the very wide variety. But if you could get, let's say, if, a few people in a room, like you were making a committee to to combat something or to actually change or innovate, not specific people, like unless you really want to, but just like who needs to be at the table to tackle some of these problems? Like, what can we do? Are there any calls to action, even if they're maybe so large that we need time to take care of them? But I think it's an important conversation to have. Like, like what would you want to get done and with whom, like, and how?
Oh, so many billion-dollar questions there, Patrice. All right.
Yeah.
I,
So all the all
yeah.
the people managing billions listen and then call to action.
Well, I love the first question. I love how the order in which, and I don't know if that was intentional, that you asked it of who would you want in the room. And I always think
Mhm.
that's the first thing, right? Of like, I joke around in the 80s, we talk about like the A team, right? And then
Yeah.
you're a part of the dream team. Like if you're a basketball
Yeah.
the Olympics, right? I'm like, how do I build a dream team?
Mhm.
Right. And then for me, the general personas I would want in the room, right, is the visionary, right? The
Mm.
one who sees beyond the possible and thinks about the impossible and pushes us. Because sometimes it's like you
Yeah.
get bogged down by what you read in the news or what you see with your own eyes
Oh yeah.
day to day, or like it's never
Mhm.
been done, right? And so the idea person and the visionary of like this is where how it can be, even though it's not like that right now, and just to be that provide that kind of optimism and thinking
Mhm.
outside the box. I always would want an innovator, right? And we talked about innovation in the beginning, but also like thinking,
Yeah.
how do we do this differently? And I think innovators are also risk takers, and it's not like, oh, it didn't
Mm.
work, but let me try 1,000 other ways.
Yeah.
Keep persevering and working through it. Of course, we need a funder, right? Right. The reality, like you
Yeah.
can't have a mission without margin. And so how are we going to like actually fund this and your operations person, right? I think the voice that sometimes gets left out of the room, of course, you'll have your subject matter experts, all those things. Uh,
Sure.
the voice that sometimes I think we're doing a better job in general, particularly in healthcare, are those who there are the end user or who we're trying to serve through tech or
Mm.
whatever topic, right? Be it mental health, be it burnout, trauma, access to care. I always think, and this is how I want to live my life. Again, my own opinions and audience take it with a grain of salt. But for me, I think having that moral compass, moral grounding of like why, going back to
Mhm.
the why that we were talking about earlier,
Yeah.
of like who could most benefit, but potentially inadvertently be harmed because of what we're doing, right? Because sometimes we think
Mhm.
we're good and you're like, actually, that might be doing more harm than good, or that actually doesn't work
Yeah.
for us, right? And I think you always
Yeah.
to have the people who you're trying to serve and or maybe directly impacted, positive or negative, by what we're doing.
Mhm.
And they think they ground us not only in our why, but also of like, may save you money, may seem like a good idea in theory, but that's not going to fly in my community, in my family, in my
Yeah.
right. So I think those are the different players I would have in the room come together. And that's what we aim to do at Weitzman, having those different
Yeah.
perspectives in whatever we do.
It does seem like a primo tactical team. Like that room can get stuff done. So this this might actually be the same question, but I'm going to ask it two different ways. So if you had to pick like one problem for that team to solve, what would it be? And is that the same thing that you are hoping to have an impact on through the Weitzman Institute?
Yeah, it would probably be what we're doing at the Weitzman Institute, right? Like in terms of access to quality and timely primary care. Because for
Mhm.
us, we think about primary care, patient-centered medical home, and all of it links back to primary care, right? In terms of
Mhm.
we're doing a lot more in terms of addressing social drivers of health, right? Food insecurity, housing instability, unemployment, being able to pay for one's utilities, all of that, to immunizations, to mental health
Mhm.
services, right? To
Yeah.
advocacy and policy at different levels. And I think so much happens, and primary care becomes a gateway to other specialty care, right? I think there's just,
Mhm.
and often is at the nexus of healthcare and public health, right? Given the overlap in what public health. I was recently at a convening here in DC, and we talk about you don't know that public health is at work until it's not working or functioning, right?
Yeah.
I think it's just being able to really uplift the importance of primary care and invest in it would be the issue I would tackle, right? Quality, timely access to quality, timely primary care.
Mhm.
There's just so many other
Yeah.
issues that are addressed and interconnected with primary care that if I had to choose one, knowing that everything
Mhm.
else that's connected to it, that would be at the core.
Yeah. I mean, that is critical. That I can see how that's the choice. And I mean, I can't do this interview without asking, has this mission been severely impacted with all of the changes? It just seems like, the access to care is more difficult. There's changes with food programs. Like how has this mission morphed, and like what do you do next to keep the mission moving forward?
I forget at what point in my life I'm like, oh yeah, that makes sense. Thinking of things as never permanent, but in seasons.
Mm,
And I think
mm,
different seasons reveal to us different issues around the same problem, right? And
mm,
so with primary care, that's why I was saying, like almost 10 years ago, I was at National Quality Forum right before I joined Weitzman Institute. And we were just
mhm.
beginning to talk about food insecurity and social drivers of health, right?
Yeah.
Housing stability. And now it's like everybody's talking about it, right? Before that, I was working on trauma informed care and it was not a thing. And then all of a sudden, everyone's talking about trauma informed care,
Mhm.
right? Like the evidence base hadn't been there. Now it's, front and center. And I think right now, you know, even at the Weitzman Institute before the pandemic, we hadn't really done much in terms of rural health, right? We hadn't
Mm.
done much in terms of technology enabled access to care, i.e., telehealth,
Yeah.
right? And I
Yeah.
think different seasons, different times of crises are also times of opportunity where we're like,
Hmm.
okay, we thought we were addressing primary, and we were definitely addressing primary care, right? Since our founding in 2007. And
Yeah.
I think just it evolves, the more knowledge we accumulate, the thing
Hmm.
it evolves in terms of what we're able to do, right? So we probably weren't doing social drivers of health, or we probably were doing bits and pieces, but it wasn't as structured, as
Yeah.
sophisticated as it is now, right? In terms of the idea of even a food pharmacy within a clinical setting, right? The idea of like primary
Mm.
care being able to write a prescription for fresh produce, right? And be that the focus for addressing one's uncontrolled diabetes, right?
Yeah.
And so I think different seasons, again, allow, whether seen as a crisis or as an opportunity, allow for us to maybe tackle the same issue through a different lens.
Yeah. You kind of skip the panic mode and you just go, it seems like just such a stable, healthy way to think about changes and anything that's potentially negative. That's beautiful. I'm glad you shared with that with us.
I know, 'cause, even earlier we were talking about being humbled or
Mhm.
finding it humbling versus overwhelming, right?
Yeah.
And I think for us, like, yeah, a lot of it is overwhelming, right? We're like, he sometimes like, oh
Mhm.
wow, there's just so much need, right?
Yeah.
But I think it's also humbling of like, okay, you can't do everything, but I can't let my, again, going back to burnout, Patrice, right? I can't let
Yeah.
all the different issues get to me to the point I'm paralyzed and operating from
Mhm.
my limbic system out of fear and fight or flight, and then just like, okay,
Yep.
I'm no longer useful to whatever cause I'm trying to address. And so I think
Mm.
step back and say, okay, what issues can we address in a given season
Yeah.
that now we have this knowledge to work with and these resources?
Mm.
I think just being able to adapt in different situations and also see them as opportunities, right? Because yes, I mean, think
Yeah.
pandemic, right? Oh my gosh, we've never done this. We weren't around in
Yeah.
the when we had a pandemic 100 years ago. Like none of us were around, right? So just the idea of like, okay, but it also presents an opportunity to
Mhm.
tap into virtual learning, like tap into creating new partnerships and elevating
Yeah.
mental health, or
Mhm.
safety and public health, where people probably weren't talking
Mhm.
about public health as much. So just
Yeah.
redirecting how we see the same issue rather than be paralyzed by what we can't do about it.
Oh, I love that. Redirecting. Redirecting the energy and what we're doing and how we see the issue. And then also, I like the other bit you said. I like to ask myself questions, especially if I'm feeling paralyzed or similar thoughts like, am I of use right now in this state? And if the answer is no, then okay, move on, redirect. Like, what can I tackle? I like that. I'm going to use that. Thank you. Oh, now we've actually covered so much ground. I want to talk about the challenge that you gave me because that's a fun one. But before then, is there anything that you want to leave the listeners thinking about, or something that you want them to do in the future?
Yeah, I mean, Patrice, when you first reached out, I was thinking, oh, what are those? And I've certainly experienced burnout, right? To the point of like, I had to leave the country and teach yoga abroad, right? Like, all of those things, right? And you had to eat, pray,
Hmm.
love. That was a huge, made a big difference in my life. And I know we'll get to the eating part. And then I realized, some of it, the burnout comes from pride, right? And thinking I have to like self-reliant. I have to do it all myself. And then I realize in times I've been burned out that I didn't lean into my tribe, my community, my colleagues,
Hmm.
staff. Right. And it kind of like an older lead in our church, sometimes she tells us, don't rob me of a blessing to be a blessing. Right. And I think sometimes,
Mm.
oh, if I see it as this is an opportunity for someone's gift to shine. Right. I don't have to
Yeah.
do it all because someone might actually, and I see this in my staff, someone might actually be better at this than me in general.
Yeah.
They might actually be in a better place to do it. And I might actually like reveal something about their own leadership and their own strengths. And so I
Hmm.
think that unburdened me from feeling like I had to
Hmm.
do everything. It was also humbling, right? It's a let go of the ego, being self-reliant. It was
Hmm.
also like spiritually a faith lesson of like, I've been given certain gifts, but I haven't been tasked to do everything all at once for everyone in all
Yes.
seasons, right? So I think there's this
Yes.
release of being able to let go, for me, let God, but also let others, right? Let others in,
Hmm.
because at some point, at other points, some people might need to tag me in and seek my help. But if I'm, overstretched, overwhelmed, overstimulated, then it's going to be actually counterproductive. So I think just
Yeah.
able to see it that way of like being able to let go may allow others to step up and shine in their own right.
That's so good. Let other people use their gifts. That could be a blessing to them to like be able to actually use it. Yeah, I can definitely relate to that where you're just like, no, I got this, I'll do it. But you don't need to. That's a choice being made, and it's a choice that leads you closer to burnout. Yeah. I want you to talk about your challenge a little bit. But if you want to say anything more about when you left the country and taught yoga, that seems interesting too.
Oh, yeah, no, and I share this. I was in the middle of med school. My dad had passed away. I became the primary caregiver for my mom, and I was in an MD
Mm.
MBA program at Harvard, right? And so I was doing it all, and and
Yeah.
at the same time was getting reacquainted with my yoga practice. My yoga instructor at that time was like, "Well, you speak Spanish. Maybe you join this UN missions trip in El Salvador, where they were looking at the use of mindfulness to support psychosocial well-being of children and families that have been affected by war." Right? They did done this
Mm.
in Nigeria. They were now expanding the missions to El Salvador. And I think for me, that was a good point of just like, at that point, I was burned out and I just had to, from everything,
Yeah.
right from school, from being a caregiver, from the passing of
Yeah.
my dad. And it was just all so much. And being able to finally release and focus on something this aside from myself and my own burnout,
Yeah.
being with children and seeing how they were living and their families were living, but that there was still joy, and the mindfulness was being able to
Mm.
support their own well-being. And sometimes that's why I think sometimes you just have to walk away for a little while and come back
Yeah.
stronger. And I think, like, again, it goes back to the eat, pray, love, right? Of like,
Yeah.
oh, I had to get away and let go of everything to come back so I could actually be of greater service rather than like trying to hold on to everything and then ending up having to drop everything because it's just too much. So I think
Yeah.
being able to give myself permission for that, again, knowing that it was just a season, I didn't stay there.
Yeah.
I moved to El Salvador, tempted, but then I actually came back, right? And I think came back
Yeah.
to be of better use to my purpose in life.
Yeah. Well, that's beautiful. And it does actually highlight that was a dramatic shift, right? Well, perfect storm of, grief and caregiving and burnout and everything that you're mentioning. But to be able to actually leave the country, that's a big step, but it was just a season. And I think some people are so scared to take that step because they think it's going to permanently alter, take away their chance at achieving their dreams or their career. And I mean, you're a testament that I think it just makes it actually able to happen. Like
I mean,
then you
acknowledging
can't push
though,
it.
right? I'm thinking about your
Yeah.
audience, and I'm reading. My favorite athlete is Steph Curry, Golden State
Mm.
Warriors, and my husband.
Yeah.
So, Steph, if you're listening, no, I'm just kidding.
Yeah.
He has this book, Shot Ready, right?
Hmm.
And it's such a great book. It's a coffee table book. My husband got it for me. And I'm reading it. And he's like,
Nice.
hey, not everyone has that luxury, right? To be able to like take a vacation, or in my case, do a
Hmm.
missions trip, right?
Yeah.
Um, but then he's saying taking little breaks, right? Little pauses in the day or in a week, and just finding that again, time to reset and recalibrate. Like it doesn't always, we don't always
Hmm.
be on, right? So he was talking
Yeah.
about that it is active to be in rest or in reset or in recalibration. So it
Hmm.
doesn't have to be as major as I'm going to drop everything and just leave the country to teach yoga. Like, no, like it's not regulate, right? Like I probably couldn't do that right now. Uh,
Yeah. Yeah.
just saying like what works for you, not just you, Patrice, but just in general,
Yeah.
like acknowledging like what are the, because there's still like you don't want to be irresponsible, right? So there's
Right. Right.
of like, okay, let's be pragmatic. What makes sense right now if I
Hmm.
walk away, but not overthinking
Yeah.
it, right? Like it's a fine line, right? So I just
Yeah.
knowing,
Well, and you said something when you're describing the experience that I think people can do even if they don't leave their home. I forget the actual words you said, but you were decentering yourself. Right? The work that you were doing when you're out there, it wasn't about you, it was about the people that were serving, and you saw the kids' joy. So like decentering yourself and then seeing other people experience joy no matter what their situation is. So like that's doable no matter where you are in the world.
yes.
So yeah, that's a great tip. And then let's talk about that foodie challenge. What what is your challenge for me to take on? Uh and why?
Yeah, so I grew up a foodie, still am a foodie, you know.
Hmm.
Was thinking, try a dish. Could be even an appetizer. I don't know how adventurous you are with your food, but you don't have to answer first. But if
I no, I am. I'm adventurous. Yeah.
try a dish from either a different dish or different cuisine that you've never had. And I shared that because I think, again, having grown up in San Francisco, having traveled to a lot of different countries and sometimes lived in different countries. My dad was an Italian chef, even though I'm not Italian.
Mm.
No, I have an Italian last name. That's a whole other conversation, Patrice.
Yeah.
And there's a lot that can be revealed through food, right? About a culture, the history behind food. I think food,
Hmm.
some people refer to it as a social lubricant, all right? We bring
Oh,
people
yeah.
together. So I just, think that there's so much about food that can bring people together and that can teach us about others' cultures and histories.
I personally love that. Super into trying new things. So I'll give this side quest for the listeners. And April, you might have already had it, but my mother is Burmese, so I grew up eating the food. Most people haven't had it. A lot of people haven't even heard of Burma or Myanmar. But if you have the opportunity to try Burmese food, you should try it. Highly recommend Onokasware, like the coconut curry chicken noodle soup. That's a good entry point for people. But yeah, is there something like your favorite dish that you want to inspire people to go look for?
I've had Burmese foods several times, including the first time I met my in-laws. But yeah, I love
Oh, nice.
spice. I do love spice. But I remember like people shouldn't recognize that their spice level intolerance
Yes.
big challenge my Burmese food. Not to get too, just mindful.
Yeah.
They didn't warn you. Well, I don't know. I guess it depends on the day, but then I think anytime I love sushi for some reason, I don't know other,
Hmm.
that it is my favorite. I could eat sushi every day. Yeah.
Yeah. That's a good one. So everyone, maybe throw it into ChatGPT, have it pick for you what you're going to try, and then go do it. But it'll be fun. It'll give you some stories, even if you don't love the food, and hopefully bring you a smile and a laugh. So, April Joy, anything you want to say before we sign off?
No, I just appreciate you having me. Had such a great conversation with you, Patrice. So I really appreciate the opportunity. I hope for your listeners that this has been a helpful episode.
Absolutely. Yeah. I loved our conversation, and I hope we stay connected. There's so much we can do. We
Yeah.
all have to partner together. There's a lot to get done. We're going to do it. All right. And everybody, thank you for listening. Remember to review and like and subscribe, and have a great day.